The Nigeria Health Watch has called on the federal government to create an emergency preparedness fund that can be accessed before and during epidemic outbreaks. The group says the need to adequately fund health security has been re-energized by the COVID-19 pandemic in order to ensure health emergencies preparedness and response system. A 2019 statistics which shows a country's preparedness to find, stop, and prevent epidemics cause Nigeria 46%, showing the country's lack of readiness. While this is an increase from 39% in 2017, the Nigeria Health Watch says Nigeria's governments must make health security a priority. The group is also calling for the creation of a sustainable mechanism to increase private sector investment in health security. Well, for more on this, the necessary preparedness and response to epidemics in Nigeria, I'm joined now by Senior Programs Manager at the Nigeria Health Watch, Dr. Kemisola Agbaoye. And in our Lagos studio, Iniobong Usen is joining us, Senior Research and Policy Analyst, BudgIT. Thank you so much for joining us, both of you. Let me start with you, Dr. Kemisola. You're right here in the studio with me. Let's talk about the very important place, or role that private sector investment plays in the health sector.
Yes, private sector investment has proven to be very effective in meeting very critical needs. We can see from the COVID-19 pandemic how the coalition against COVID-19 came together and raised funds to bridge some of the health gaps that were identified across the country. The private sector is very well organized usually and very well funded as well. I mean, we have major private sector organizations and companies like Dangote come together and bring together, very important stakeholders in that space. And their response was very swift. They responded to the socioeconomic difficulties that Nigerians were facing, as well as rapidly building health facilities, isolation centers to respond to the COVID-19 pandemic. So just from that example alone, we find that we have such an untapped potential in our private sector. And it's really important that we begin to think of mechanisms to make sure we draw from that very vibrant and full space in order to respond to future epidemics and pandemics.
Absolutely. All right, let me take it to Iniobong Usen in Lagos. Underscore again for us the importance that one would derive from the state governments or even federal actually dedicating a budget for, to prepare for this kinds of health emergencies, which BudgIT states. Help us understand that.
Yeah, so thank you for having me. The COVID-19 pandemic actually made it known that pandemics or epidemics are here to stay with us. And that is no longer a matter of if, but a matter of when. As you know, in 2020, the global economy declined by 3.2%. Global trade declined by about 5.3%. And domestically, there was little revenue for government, both at the national level, the state level, and the local governments to implement their budget. At some point during the year in 2020, the state government had to get bailout funds from the federal government to be able to meet up with their recurrent liabilities. So as it is, when pandemics or epidemics occur, economies are ruptured, the health systems in countries are affected, and there's very little productivity in country for governments to be able to raise revenues from taxes and for them to be able to implement their budgets. So it's important that government take the issue of health security very, very seriously. And from what we've seen, say for states like Lagos and Kano states, there are very few states that have epidemic preparedness line items in the budget. And for those states, it's even a problem with funding. So we found issues where they have created budget line items for epidemic preparedness, but at the end of the budget year, very little funds have been deployed for those line items in the budget. So moving forward, I think it has to be an all-encompassing approach. I know the guest in the Abuja studio had mentioned earlier that there's a lot of role for the private sector to play. And Section 25 of the Company Income Tax Act allows companies to make tax-deductible donations to epidemic preparedness line items in the budget of both the national budget and the budget of the state government. And we envisage a situation where private sector would deploy funding, right, to fund epidemic preparedness, both at the state government, the subnational level, and at the federal level.
Dr. Kemisola, you heard what he said there. Apparently, it is clear that state governments or even federal cannot do it alone based on what we have seen with COVID-19, that the private sector had to step in. But there's also that challenge of, accountability, even within the private sector, when they have to step in to intervene at the level that they did with COVID. How do you ensure that? And then again, there's a challenge of accessibility. It's one thing for governments, to, dedicate funds for these kinds of contingencies. But then again, access is a challenge. How do you overcome all of those?
Right. You've mentioned some very real challenges that we face in Nigeria when it comes to funds management as a whole. And like you rightly said, one of the biggest challenges is access. It's making sure that the funds that have been allocated to, say, the health sector for epidemic preparedness and response are actually released. And not just released, but released on time. Our budget comes out in December every year. It's signed as centered by the president in December every year. But we find that some of the ministries, departments, and agencies don't receive their funds until the second quarter, which means they don't start implementing programs until the second quarter stroke third quarter. And by the time the fourth quarter comes around, when it's time to pass another budget, very little has been done. So there has to be, we need to review how funds are released and managed at all levels, at the federal and state levels. I mean, when it comes to monitoring and evaluation of how projects are implemented, projects that funds are released for implemented, we really fall short. We have issues of transparency. We have issues of accountability, like you said. We need to start thinking of making sure that there are mechanisms in place and that the right people are there to make sure that the funds that are released are used for what they were budgeted for, what they were allocated for in the first place, and that we start to measure the achievements of, or measure the results of those funds in very real terms. We need to start looking at our health indices. How have they changed? How has, for example, Nigeria moved from, say, a 39% to a 46%? I'm referring to the joint external evaluation of our health security indices in Nigeria. We were 39% as at 2019, as at 2017, sorry, yes, as at 2017. And as at 2019, we had a midterm JEE, a midterm joint external evaluation, and we scored 46%. And that was before COVID.
Not very bad, considering.
Well, it is bad if you think about the next, like the guest in Lagos said, the next pandemic, the next epidemic. We need to do way better than that, because this is people's lives we're talking about. We saw how difficult it was for many countries during COVID. And we haven't even quite measured where we are now with COVID-19. COVID-19 has done two things. That's caused countries to boost up their systems, their health systems, in order to be able to respond to the next pandemic. But it has also exposed gaps. I mean, we saw blatant gaps at the level of the primary health center, for example, primary health care, for example. We need to think of how our funds are making sure that our health indices improve in terms of health security, yes, but more so in terms of maternal and child health, for example, in sexual and reproductive health. We need to make sure that we're measuring it in those terms so that we know that we are, really getting value for money.
Iniobong, let me bring this to you. I mean, there can't be security, or you can't have health security if you don't have, security, ensuring that people will feel safe and all of that. In your findings as budget, what have you come up with so far? And do you have recommendations in a way that can ensure that, both, general security and health security go hand in hand, especially in the northern part of the country, and I must say in every part of the country?
So we had developed a health security accountability framework that contained all the 19 technical areas for the IHR core capacities. However, it's been quite difficult populating that accountability framework with data. And that's largely due to the fact that the reporting template provided by the Budget Office for MDAs to report the implementation of their capital budget, right, doesn't give room for disaggregated reporting. Hence, it's very difficult for us to know exactly the areas that's among the 19 technical areas where funding has gone to. If you look at the National Action Plan for Health Security, you would see that the plan was supposed to cost about 134 billion naira. And the bulk of that funding was supposed to come from partners, while the rest of it was come from funding from the federal government and from the subnational government. But as it is, whilst we have very visibility on what exactly partners are funding, right, in terms of the technical areas, we have very little visibility on what exactly it is that the federal government is funding. And that's because you just have one line item in the budget implementation reports as regards the implementation of the capital budget of the health sector. And if you look at the states also that have been able to create budget lines for epidemic preparedness, you would not find a breakdown that allows you to know what exactly probably the government is spending on zoonotic diseases, on surveillance, on biosafety and biosecurity and the likes. So for us to be able to act as very efficient accountability actors, we would need the reporting templates to be in such a way that these line items are disaggregated. And that's largely because since this plan, is like a multi-year plan, future budgets would have to be predicated on the implementation status of the previous year's budget. Without that, we cannot really know the funding gaps and thereby, deploy the right advocacies for funds to be deployed to where the gaps have been found.
All right. Apparently, Iniobong, is a question of transparency, opaqueness in all of that. Thank you so much, Iniobong Usen, a Senior Research and Policy Analyst, Budget, and Dr. Kemisola Agbaoye, Senior Program Manager, Nigeria Health Watch. Thank you both for joining us on Newsnight.